This is a very exciting study that will provide access and investigate safety, efficacy, and tolerability of ropeginterferon alpha-2b in patients with essential thrombocythemia. It's designed for the North American patients, so United States and Canada, that have essential thrombocythemia and are either therapeutic naive or hydroxyurea refractory or intolerant. So ropeginterferon is a novel monopegylated interferon that has a more favorable form. Thus, it has more convenient usage of once every 2 weeks at the beginning. It's subcutaneous agent, and once we achieved a good hematology control, it could be used once every month. So we have used other forms of interferon off-label in patients with essential thrombocythemia over the past about 30 years. And we have seen that the agent could actually offer disease modification or go after the disease etiology, which is actually not achieved by any other currently available medications. So ropeginterferon as a novel pegylated interferon is already approved for patients with polycythemia vera in the United States as well as the European Union. So this study is going to investigate its role in patients with essential thrombocythemia. It is designed for, as I mentioned, United States and Canada, patients with essential thrombocythemia, confirmed diagnosis that have elevated platelets over 450,000, elevated white cells, and then either are treatment naive or have failed hydroxyurea, which is a standard frontline therapy in these patients, which could actually happen up to 20 or 30% of patients with ET. Then patients will be given access to ropeginterferon, which will have a little slightly faster escalation. It's a drug that's given subcutaneously every 2 weeks in a dose-escalating manner. So with the standard would go 250, 350, and 500 microgram every other week as a dose escalation. There will be the first titration period for a month, and then the study will include additional up to 56 weeks of a core treatment period during which the endpoints will be looked at. The study is multi-center. They should have about 25 sites. The estimated amount of patients is about 64. We're not there yet for sure. We just started. And the Anderson Cancer Center is one of the participations in Houston, Texas, and the center by John Mascarenhas and a couple other, lots of good researchers and investigators in MPN field. Currently the study is enrolling. MD Anderson still has not basically not any patient, but we have a couple lined up. We have been dealing with some regulatory ordeals to get patients started and a little bit of a patient supply. So hopefully we'll speed up the enrollment very fast because we actually have a few patients already waiting for being enrolled. As far as I know, there are a couple patients already enrolled, but I think that the numbers are going to change very quickly. So let's see how that goes. So the primary endpoint for the study is going to be a durability of response rates, which is the standard hematologic response or control of white cell and platelets. The secondary endpoints would include other relevant endpoints that exist in patients with essential thrombocythemia, including checking on the level of JAK2 burden or other mutated malignant clones that could be in patients with essential thrombocythemia, such as carleticulin or MIPL. There's also optional looking at the bone marrow biopsy and considering the bone marrow response as a complete morphologic remission. That actually are two endpoints that interferon, the previous formulations interferon showed are capable of. And there's also data that this is capable with ropeginterferon. So those are very exciting endpoints, especially I am going to be really looking forward to it, to see whether we could do more than just control the counts and then prevent the thromboembolic events that are currently a standard of care for our endpoints. Coming from it, we'll look at the composite endpoints that would include actually complete control of blood counts, absence of thromboembolic complications, and kind of like getting patients symptom-free. So those are really important markers in patients with overall MPN as well as essential thrombocythemia, and I'm really hoping they're going to shape or define our way how we look at the disease in terms of what we can achieve. Particularly a way if we show we could possibly alter the disease in terms of progression to myelofibrosis or acute leukemia. That actually has been already shown in polycythemia vera last year on the final analysis of the continuation PV study. That would be quite exciting because essential thrombocythemia may actually impact a lot of young individuals, particularly very young females or very young males that may live with the disease for literally a decade, 30, 40 years, where at that point the disease has quite substantial chances of progression to myelofibrosis and acute leukemias, which none of us wants to see because at that point the outcome is miserable. And although we are moving the field of myelofibrosis quite significantly with more drugs, more options, we're still not able to extend their survival beyond what we kind of see. So I am pretty positive we'll see a better outcomes down the road. But currently, starting or trying to stop the disease progression is one of the most important endpoints we should come up together, and we hopefully be able to tackle with these ropeginterferon trials. Well, I'm really excited to see again the patients on the study. So we would like to enroll as many patients as possible. We encourage younger patients eligible to really reach out to the centers that participate in the clinical trial and get evaluated for a possible participation, where we really could explore the next goal of therapies for patients with MPN in the decades, and hopefully also move the field of essential thrombocythemia from controlling the counts to controlling and getting rid of the disease.